Discover how red light therapy shines a new light on pain relief. We're going to talk about a therapy that is new again. Actually, red light therapy or red light laser therapy has been around since the 1980s, but now it's become this rage. People are getting these red light booths that almost look like a tanning booth, except it's not putting out those different rays. They are using masks for their acne. They're putting hats on for hair growth. They're using wands for different parts of their body. They're buying mats and laying on those red light therapy mats, or they're buying something like this, different sizes of something that can go on a shoulder, on the low back, on the knee. So today we're going to uncover some details about this red light therapy. And if you stick around to the end, I will summarize a great review article that's gone over dozens and dozens of red light therapy studies and give you the ideal wavelengths and the ideal power watts, milliwatts per centimeter squared, so that you know if you go out and buy something personally, or if you're shopping around for a place to go get some red light laser therapy, you know what you're talking about and you know what is actually going to be proven to work based on these studies. So let's back it up. What is red light therapy? It is essentially taking a wavelength. Red penetrates the skin deeper than blue, and that wavelength is altering or kind of putting a signal out to the body that says, hey, there's something going on here. Listen up, everybody. It's time to do some work. And in terms of specific uses, I've alluded to a little bit there. It's been in the past for acne and hair loss and just generalized things, maybe mood, maybe overall well-being, but we're in the musculoskeletal space. So specifically, I'm interested, and I know you're interested in, what does it do for pain? I've got arthritis. I've got tendinopathy, or a tendon that is inflamed. So that's exciting. That's where we can look at red light laser therapy or photobiomodulation. Let's just call it PBM from here on out because it's so much easier to say. PBM can be utilized as part of your treatment approach. What I love about this, and I'm going to use notes today because we're talking about specific studies and I don't want to get anything wrong. What I love about it specifically is it has been shown to reduce pain and increase range of motion, increase function in conditions such as tendinopathy. Remember, in the knee, we can talk about things such as patellar tendinopathy, or that kneecap in our runners and jumpers. We can talk about the hamstrings having tendinopathy when it's associated with knee osteoarthritis or a meniscus tear or a meniscus strain. Then we move on into just plain old osteoarthritis. Although there's been some studies with rheumatoid arthritis, that's not the focus here since osteoarthritis is the most common kind of arthritis. But specifically with osteoarthritis, we're looking at things such as increasing the thickness of cartilage. I did not know that was possible until I started doing some research because patients are asking. They're saying, hey, I'm interested in buying this mat, or hey, I'm interested in going to this place that has a red light bed. What do I need to know? So I've done some research here. I do think that it's very promising. Obviously, we need to look at some safety considerations. And so in general, it's safe for most people. What you might not want to do is place it over an area that you've had skin cancer, because we don't know that that red light can't potentially induce something. It's not likely, but that's just one of those disclaimers. Another would be that if you're in one of those booths, or if you're using a stronger red light, that you consider goggles, kind of like when you have gone, if you've ever gone to a tanning bed in the past, remember those little special laser goggles. And you would want to make sure that if you have any problems with your eyes in particular, that you've had cancer in your eyes, you've had an infection in your eyes, that you're not likely exposing those eyes to the same red light laser. So the other frequently asked question people talk about are, can you use red light laser therapy in pregnancy? And to date, there have not been any studies that have talked about problems to the fetus or to the mother in the use of red light in pregnancy. However, I would speak with your OBGYN if you're concerned about and interested in starting red light laser therapy. Let them weigh in on this. The same from in general. it has not been shown to have any issues. Another caveat is a lot of people are using red light laser therapy for things such as weight loss, and that has not shown positive evidence for actual weight loss. It may change the fluid content within the skin. You may lose like a half an inch when they're measuring pre or post red light laser therapy or photobiomodulation, but it is not likely to stay or last. It is very temporary. So let's dive into some of the research. And I will link this to the video. This is from the International Journal of Molecular Science in September of 2023. So it's very recent, but they've gone back and done some great studies. Let's just give you some very specific numbers, and then I'm going to show you how to potentially use this on your knee. 34 chronic knee osteoarthritis patients. The wavelength was 905. It was effective in reducing pain, improving cartilage thickness through the changes in the biochemistry at the cellular level. 88 hand OA patients, reducing pain, morning stiffness, improving functional status at 860 wavelength. Knee OA, 47 of them, 904 on the wavelength, can improve pain and function in patients with knee osteoarthritis in the short term. 36 female and 14 male degenerative OA of the knee, wavelength 630 and 830. It's effective in relieving pain and disability in degenerative knee osteoarthritis. Here's 61 patients with low back pain for at least 12 weeks, 810 on the wavelength. In chronic low back pain patients, photobiomodulation combined with exercise is more beneficial than exercise alone. Here's some more knee. 53 male knee OA patients, 830 on the wavelengths. The high-intensity laser therapy combined with exercise was more effective than low-intensity laser therapy combined with exercise. Both treatments better than exercise alone. Here's another 830, 49 knee patients. It was applied to specific acupoints in a shorter time, together with exercise, can effectively reduce the pain of knee OA, improve quality of life. It keeps going on. So again, this is a great evidence-based, a lot of articles that they've summarized beautifully, and we've linked it here. So go ahead and look at that. But here's the gist of it. The wavelengths for the effective minimum in the 630s, 650s. Most of the effective were in the 830s. So when you're doing shopping, when you're comparing either getting a product for yourself or going somewhere to get this, then you want to look at that. So this device specifically that I have here called a red light therapy, it is a pad, and this will fit like on the low back, or it will fit on the knee. I'll show you that in a second. It very specifically says that it's got different modes. One is at 660, and then there's an invisible wavelength at 850. So we've covered that with this product. This should, if applied the way per the manufacturer's directions, this should increase your likelihood of getting some results. So let's show you how easy this could be. And I'm going to tilt the table down. But again, this is the thing that's going to emit the light. This is the plug-in power pack. I have that plugged in already. I'm going to place this around my knee. So let me turn this down here. I'm going to place this on my knee, and I'm going to actually wrap it with the Velcro. It allows it then to stay on, because we'll want to be able to kind of chill, maybe when you're reading, maybe when you're eating dinner, maybe if you've already worked out and you're watching TV. So there's that. Go to the remote, turn it on, change it to, remember we wanted the 850. So I'm going to start that, and you'll start to see some red lights inside here. I'm not going to show the whole amount, because just in case somebody's eyes are very sensitive, but know that you can kind of see that little red light going. So now I'm going to move my leg down. I'm going to turn back here. So that was the secret. We want to be at least in the 660s, ideally in the 830s. This product has an 850. So look for something like that. Read the instructions. Know that another option, if you do have knee scar, is the begin, because it can be used for things such as acne and skin conditions, that this may also help with changing the collagen, changing the skin thickness, and changing any restriction in motion of that area where the scar is, for example, over the knee because you've had a knee replacement. So this may kind of take care of a couple different things, some aching, some stiffing, some tendinopathy, residual arthritis after a non-replacement surgery, the scar after a replacement surgery, all in this PBM, photobiomodulation. What is old is new again, and it's pretty exciting. I think we have a little bit of more data to collect in general to further hone in on the actual treatment protocols per se. If you go to an office that has a red light laser and they're focusing in very specifically, they kind of put a laser beam that's on your area of pain, then they probably have a protocol. But do ask what wavelengths, what is their protocol? Will they give you some little goggles to protect your eyes? All of these things are really important. If you have any questions about this, please do reach out, respond in the comment section below. And if you have knee pain from arthritis, we invite you to join our masterclass to learn how to feel better. Specifically, we're going to teach you about why your knee hurts, simple stretches that can help you reduce the pain. You'll discover which knee braces work best and why they help. Our tips are going to make your knees feel stronger, less sore. So sign up now to take control of your knee pain and get moving again. Please like, please subscribe, comment, and your comment may be the topic of our next video. Thank you for watching. Take care. If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.